Hi, my name is Raquel Hatulan, a first-year student nurse at Davao Doctors College. In this video, I will be performing the two types of unoccupied bed making. The first one that I will be performing is the unoccupied closed bed. For this type of bed, the bed has no assigned patient yet. The first thing that I would do for this procedure is perform hand hygiene. It is very important to perform hand hygiene because it will help to prevent the spreading of germs and cross-contamination. Now we proceed to the bed making part. Before anything else, you have to remember and you have to be sure that your materials should be assembled and are placed on the bedside chair. They should also be arranged according to their order of use. So in my case, I have already arranged my materials. The first one is the bottom sheet, the second one is the waterproof underpad, the third one is the cotton draw sheet, the fourth one is the top sheet, and the last one is the pillowcase. Now we place the bottom sheet. The center fold of the bottom sheet should be placed in the center of the bed. It should be hemmed side down to support a smooth foundation. So as you can see, the larger hem is placed on the foot side of the bed, while the smaller hem later will be placed on the head part of the bed. Now we proceed to the unfolding of the bottom sheet. It should be unfolded right side up and it should be tucked on the head part. Before I tuck it, I have to be sure that I separate what is also needed to be on the other side, so that they will be equally separated. So you have to roll this. Now we proceed to the tucking of the head part. It is important to remember that the head part will be well tucked because it will secure its place properly if it is well tucked. Now it's time to create a miter corner. After creating a miter corner, we have to tuck it. We have to tuck the sides. have to tuck all the side from the head to the foot area of the bed. So this is the miter corner of the bed, and every side is tucked. It's time to place the waterproof underpad. It should be about 18 inches from the head part of the bed. The third one is the cotton raw sheet. It should just be above the waterproof underpad. So they both help to protect the mattress from dampness and soiling. Now we proceed to the top sheet. The larger hem of the top sheet should be placed on the head part, and the smaller hem should be placed on the foot part. So in this case, once you unfold the top sheet, you don't have to do a mitered corner on the head part. It should just be on the foot part. So now we are going to unfold it. Now you're just going to do the procedures that you did with the bottom sheet. The only difference from this is that you don't have to tuck all the sides, and the only thing that you should tuck is the miter corner that you will be doing on the foot part. You're going to separate this to let it hang on the sides. Now we proceed in doing the mitered corner of the foot part of the top sheet. So of course you have to tuck it first. so you don't have to tuck the sides. You just let it hang on the sides. But there is a mitered corner on this foot part. Before we move to the other side, it is important to place the hem of the top sheet 16 inches from the head part. So we are going to move this. So this is about 16 inches already, and now we are ready to move to the other side to do what we did on this side. Now we are ready for the other side. So the procedure will be just the same as what we did on the other side. The only difference is that it's already on the bed. So now we are going to proceed with the bottom sheet. So we are going to tuck the head part. And we're gonna try to make the miter corner. You have to tuck this again. Tuck all the sides. Now we proceed to the waterproof underpad. Next is the cotton draw sheet. And the top sheet. So we're just gonna let it flow on the sides, but we're gonna tuck the foot part and make a miter corner. have to pull the sheets firmly so that there will be no wrinkle left. And now we're done with the sheets. Since we are now done with the sheets, we're now going to proceed with the pillowcase. In doing this, the other hand should grip this side of the pillowcase. And the other one will be responsible in opening the pillowcase. So since we have opened it, the one that grip the side of the pillowcase will do this and will hold and put the pillow inside the pillowcase through this way. You have to fluff the pillow so that it will fit the pillowcase perfectly. Since there is an excess of pillowcase, we have to fold the excess pillowcase on the inside. So, it is already folded on the inside. We do this because a fit pillowcase is more comfortable for the patient than a wrinkled one. And as you can see, the opening of the pillowcase is faced on this left side because it shouldn't be on the side of the door. And as you can see, the door is on the right side of the bed. Since we are done with doing the bed for an unoccupied closed bed, the last thing that we would do is hang the gown, the towel, and the face towel on the headboard of the bed. And that's the unoccupied closed bed making. The next type of unoccupied bed making that I will perform or do is the unoccupied open bed. For this type of bed, the patient is expected to come to the bed. So for this one, the first one that I have to do is also perform hand hygiene, but I already did that a while ago. And the second one is assemble all the materials that I need. So for this one, the materials that I would need are also the same materials that I already used for the unoccupied closed bed. So I am just going to make a few adjustments using the same materials a while ago for this type of bed. For the bottom sheet of this bed, you have to unfold it as the same as the closed or unoccupied bed. So it is already unfolded and it is already arranged. And it is also tucked in. So what we're going to do now is we are going to focus on the top sheet. So for the top sheet, we have to fold this or fan fold up to the foot part. You have to be careful so that you won't bring the other sheets with you. So we already folded the top sheet up onto the foot bed. So we will just let this is exposed because the patient is expected to come anytime soon. Again, you're just gonna have to fluff the pillow and so that it will fit the pillowcase perfectly, and also just put it on the head part of the bed once again. Since the unoccupied open bed is now ready for the patient, the last thing that I would do now is place the gown, the towel, and the face towel on the headboard of the bed of the patient. After that, my job is done and I am just going to leave the room in order, and it is already in order. So now I'm free to leave the room.